Dr. Brian McKay, and I'd like to tell you about an exciting new treatment called Lumbar Spinal Decompression Therapy. I have a story behind it. A while back I hurt my back fixing my wife's car. She had a flat tire, and as a result my back was in terrible shape for a long period of time. And it's kind of embarrassing as a chiropractor to have a bad low back because there's really nothing I can do about it. So you have to try a whole bunch of different therapies. I tried acupuncture, medication, swimming, therapy, massage, you name it, I tried it. I thought I may have to live with this problem. One day a guy stopped into the office, a salesman, and he was trying to sell me a fancy new machine created by one of the top neurosurgeons in the world by the name of Dr. Norman Shealy. And Shealy was a pioneer in the field of neurosurgery. He also created a number of other health devices like the TENS units, which you'll see some people for pain modulation. Well, anyhow, to make a long story short, the guy said to me the price was about $125,000. I quickly told him no, and I tried to shoo him out of my office. And what happened was, he said, I'll leave it with you for 3 months, and no charge. You give it a try, put your worst patients on it, and I did, and I was the worst patient. I often refer to this as my hair club for men story because I was a client. And as a result, I bought the machine. I've been treating people for many years with a lot of success. And I invite you to take a look and see how it may help you also. Thanks very much. I'm Dr. McKay, Stamford-Darien. Here we are demonstrating the spinal decompression treatment. We have Charlie, our patient here. You may notice he's strapped in above the waist and below the waist, and we have a certain amount of tension that will pull the lumbar vertebra apart very gently, and it decreases the pressure within, allowing the disc to heal. Now, I'd like to do a demonstration for you, kind of give you an idea of the principle that it works on. What I'd like to demonstrate is the principle that the machine works on. The disc is a shock absorber, and I want you to think about the blue material here as being disc material. And what happens in a herniation is the disc will be compressed and it'll come out of its normal confines, kind of like the fluid is coming out of the tube right now. And by decreasing the pressure within the disc space, what happens is the material reabsorbs and it takes the herniation to bulge away. So it's a very simple principle, but it's also very effective because we're doing it non-surgically here. So the idea is we want to avoid surgery, get people back to healing and take the pressure off the nerve, and that's how we reduce the pain. And I just want you to take a look over here. You'll see how comfortable the treatment is. There's virtually no pain involved. And there's a series of treatments that usually lasts about 15 to 16 treatments, and these people are getting back to work and back to their lives sooner. Now, we have a patient right here. This is Charlie, as I introduced before. Charlie, why don't you tell them a little bit about your back pain and how you feel after this particular treatment?
After the treatment, it feels a lot better. Pressure is relieved from my spinal cord, which helps the pain in my leg and my lower back. I like it. Makes me feel good.
See, a happy patient, that's what we're looking for. Listen, I'd like to thank you. If you have any questions, you can reach us on our website, which is listed below. Thanks very much. I'm Dr. McKay. Have a good day.
It's helped me immensely with my back pain. It stretches me out. I go out here much looser than when I come in, and it's been really a great thing for me. And I feel so much better. I go on a machine, I get work done, and my whole life has changed. And it's due to Brian and everybody that works here. They've all been fantastic for me. It's made my life totally different. Thank you.
Okay, my name is Mike, and I was in the moving and storage business for approximately 25 years, and several times I pulled my back and I started visiting chiropractic. But since using the table, I feel my back is stronger and I have much improved.